Welcome back to the CPC Exam 30-Day Prep Series by KS Medical Coding Academy. This is day 19, and we're diving into Pathology and Laboratory, Part 1, based on the 2025 CPT guidelines. Today's focus includes organ and disease panels, therapeutic drug assays, drug testing, and the chemistry section. Section Overview. The Pathology and Laboratory section spans from Captain Code 80047 to 89398. Today, we'll cover the initial part, panels, drug testing, therapeutic drug assays, chemistry section. You'll find this section in the red or pink tab of your Captain book. Let's begin with panels. Organ and disease panels. Panels are groups of tests that are commonly performed together. Each panel has specific required components. You can only report the panel code, like 80053 for a comprehensive metabolic panel, when all required tests are performed. If even one required test is missing, code the individual tests separately. Be careful not to report both a panel and its individual components together. Therapeutic drug assays. Therapeutic drug assays are found in the CPT 80150-8299 range. These codes are used when a provider monitors the level of a specific drug in a patient's system, such as digoxin or phenytoin. This is different from drug screening, which we'll cover next. Use 80299 if no specific code exists for the drug being monitored. Drug testing, presumptive versus definitive. Drug testing codes are divided into two types. Presumptive testing, codes 80305-80307, for initial screening. Definitive testing, codes 80320-80377, for identifying specific drugs and levels. Presumptive tests use methods like immunoassay and are often qualitative. Definitive tests use more precise methods like GCMS or LCMS and are usually quantitative. The code you choose depends on the testing method, number of drug classes, and units tested. Chemistry section. Next is the chemistry section, spanning CPT 82009 to 83799. These codes represent individual tests for substances like glucose, calcium, cholesterol, and hormones. For example, 82310 is for calcium. 82947 is for glucose. 83718 is for LDL cholesterol. These are some of the most frequently used lab codes in practice and on the CPC exam. Exam tips. Here are some important tips for exam success. Do not split panel codes unless required components are missing. Understand the difference between presumptive and definitive drug testing. Always refer to Captain guidelines and parenthetical notes to avoid bundling errors. Chemistry codes are often straightforward. Know the basic lab tests and their Captain codes. Quiz questions. Now let's test your understanding with 5 CPC-style quiz questions. Get your paper and pen ready. Pause for each slide, question. What's next? Up next is Day 20, Pathology and Laboratory, Part 2, where we'll explore microbiology, cytopathology, surgical pathology, and more. Make sure to subscribe, hit the bell icon, and stay consistent with your preparation. See you in the next video. Welcome to Day 20 of the CPC Exam 30-Day Prep Series by KS Medical Coding Academy. Today, we'll complete the Pathology and Laboratory section, Part 2, and end with a 10-question CPC-style review quiz. Overview of Day 20. In this session, we'll cover microbiology, cytopathology, surgical pathology, urinalysis and other tests. And finally, we'll test your understanding with a 10-question final quiz to wrap up this section. Microbiology. Microbiology codes range from 87,003 to 87,999. They cover procedures like cultures, sensitivity testing, and DNA-based infectious disease testing. Common examples include 87,086 for urine culture, 87,491 for amplified probe detection of chlamydia trachomatis. Reflex and confirmation testing may require add-on codes, so pay attention to code pairs and parenthetical notes in your CPT book. Cytopathology. Cytopathology, found in codes 88,104 to 88,199, involves the study of individual cells to detect abnormalities. It includes Pap smears, fluid analysis, and fine needle aspirates. Examples: 88,141 Pap smear manual screening, 88,175 cervical or vaginal screening, automated. These codes often depend on method and interpretation level, so read the descriptions closely. Surgical pathology. Surgical pathology spans CPT 88,300 to 88,399. It includes gross and microscopic evaluation of tissues, such as biopsy or excised specimens. Surgical pathology is categorized by level 1 to level 6, based on specimen complexity. 88,305 intermediate level, commonly used. 88,309 very complex tissue, level 6. Review the specimen list in the Captain book to correctly match the code level. Urinalysis and miscellaneous testing. The 81,000 to 81,099 range covers urinalysis and basic lab tests. Examples include 81,001 urinalysis with microscopy, 81,025 urine pregnancy test. Other procedures include blood gases, sweat tests, and sperm evaluation, often grouped under miscellaneous codes in the Path and Lab section. Quick book navigation tips. Here are a few tips for navigating the Path and Lab section. Use the alphabetic index for test names like Pap smear or urine culture. Don't forget to check add-on codes and modifier notes. Understand key differences between cytopathology, cells, surgical pathology, tissues, and microbiology, organisms. These distinctions will help you avoid costly errors on the exam. CPC Review Quiz. Read each question. Let's test your knowledge with a 5-question final CPC quiz. Each question is based on real CPC exam patterns. Write down your answers as we go. That completes Day 20 in the full Pathology and Lab section. Up next, we'll begin Medicine and HCPCS in the coming sessions. Push pin subscribe to KS Medical Coding Academy bell. Hit the bell icon for daily CPC exam videos. Speech balloon. Drop your quiz score in the comments below.